I'm Martha Raymond, and I'm the CEO of the GI Cancers Alliance. And we're an alliance of over about 120 advocacy organizations and partners globally that come together working on all of the many areas in the GI cancer space, and really a patient-centered organization that we really just want to unite and have a stronger voice for all of our patients. And that's really one of the reasons we wanted to work on a collaborative roadmap, which we're very excited that we just launched while at ASCO 2025. And just to give a little bit of a background on how the report came about, as we know, GI cancers account for approximately 1 in 4 cancer-related deaths in the United States. And yet so often patients face delayed diagnosis for many reasons: lack of awareness, lack of education on symptoms. And when they are diagnosed, many faced fragmented care and uneven access to care, unfortunately. So with these systemic challenges, we felt it was an opportunity as the GI Cancers Alliance and our many stakeholders to come together, grounded in collaboration with a patient-centric care model, to come together and see what we could do collaboratively in partnership to create this roadmap. And so we began in January of 2025 at ASCO GI. We convened really one of the first of its kind roundtables to define our shared priorities and co-develop actionable solutions, focusing again on the patient from diagnosis to treatment to survivorship, and then quality of life all throughout the journey. And one of our main priorities was to make our roadmap, again, actionable and scalable, so that from the smallest organization to the largest organization, even from individuals that are thinking, boy, I'd like to make a difference. So throughout our roadmap, there are many examples of programs that are underway, opportunities to learn about how to size and scale a program or an initiative, and then those key takeaways of, lessons learned along the way, which we've all had, and also many examples from our patients where opportunities exist for gaps in support currently, and what we can do to minimize those gaps and hopefully meet those support gaps. As you know, GI Cancers Alliance, in our research that is published in several journals, we really focus on patient-reported outcomes research, because we always feel that speaking with our patients, whether that's in interviews or focus groups or town halls, that's where we learn what is missing, what are their challenges, and then we develop actionable programming that can help meet those needs again. So in bringing together our stakeholders, we really were very intentional to bring together healthcare professionals, industry, so important in our work, our patients, our caregivers, long-term survivors, then the advocacy community. And I would like to mention our industry supporter in this initiative, who has just been wonderful to work with, is AstraZeneca. And they realized the need especially in our GI cancers community, because so often, like I said, patients are not aware of symptoms, or they may not understand that what they're experiencing could be a symptom. And so, working collaboratively, we met with our patient communities and we said, what are you feeling are the short-term priorities? And we got a good understanding from so many different patient communities, which was incredible. And then we went into, what can we do? What are the challenges and how can we meet them? And then also the long-term solutions, long-term challenges. And so much of the information we learned, especially in the short-term challenges, we outline in our roadmap. And some of them include education and awareness. So again, all of our awareness campaigns, really looking at them and saying to ourselves, do they meet the needs? Do they answer the questions? So I think it's a time for all of us to be a little reflective and say, these campaigns, are incredible what we do, but do they need a tweak? Is there something we can all learn together for our patient communities based on their responses? And then also something so important is the uneven care that so many patients experience, unfortunately. And that could be anything from, maybe not receiving biomarker testing, which we know is just so important at the beginning of a journey, to additional testing. Is there a family history? Should the hereditary testing take place, et cetera? Many patients, especially in underserved communities, were not aware that that testing existed. And so that's another opportunity for us to say, okay, we know this is a gap, and how are we all going to work together to, meet those needs for all of our patient communities? So those were some of the short-term findings after speaking with our patients. And then long-term outlook, we really hope that the guide, the roadmap, it will be evergreen. It will live on. And it really is, it's a guide, but it's also an invitation because we want to make sure that we are meeting needs today, tomorrow, and the future. And so I invite all of our GI partners and individuals that are maybe looking to get involved in advocacy to reach out to us, to tell us what you're doing, what has been successful, what are, your goals, because then working together, we can amplify our efforts. And so long term, that really is one of our main call to action items, is to continue this process. And I would love to, maybe in a year from now, meet again to say, okay, where are our successes? What can we learn? And there could be a volume 2 of the roadmap and a volume 3, because I do think together, working collaboratively, there's really nothing we can't accomplish. We can reimagine what's possible. And I think that's exciting for us as advocacy organizations to really think beyond what one organization can do and think about collaboratively, all of us working together to meet our patient needs, what that will mean for the community. I think it's, like I said, I think the sky's the limit on that.